So your child hurts when they pee. They're complaining that it hurts. What do we need to think of? Well, the first thing we always put in there is, you have a urinary tract infection. But is that actually the most common diagnosis? Usually not. Watch the video on the topic you need. Know what to do, make the best decisions for you and your baby. Helpmommy.com, the ultimate resource that's available wherever you are. Well, the first thing that you need to know is, does it only hurt when you pee? Does it hurt just as the pee is coming out, and then the rest of the time you feel fine? Because that's what's going to happen with a bladder infection. A bladder infection, it will only hurt when you pee. Now, if it hurts worse when you pee, but they always have some irritation there on their bottom, that's probably something that's more irritating on the outside of them. So like a little girl, that could be what we call vulvovaginitis. This is where you have an irritation, and that irritation could be caused by yeast infection, could be caused by a reaction to toilet paper or your wipes. It could be caused by a diaper rash. In boys, it can be caused by the urethral opening, sometimes getting more narrow. This is something that happens either congenitally, or can happen from repeated trauma where it gets stuck to the diaper, or it can happen from an irritation where they've gotten hurt somehow and it hurts as it comes out. The other thing that we see is that people say that they can't get pee out. It doesn't necessarily hurt, but they're straining. Well, then you have to think of possibly a urinary tract infection, also some sort of obstruction, and that may be something where there's a stricture in the actual tube, or very commonly, they're constipated, and that stool actually in their colon is right behind their bladder and can sometimes squeeze on their bladder, making them think that they have to pee more frequently, or squeeze on the urethral opening and not allow it out, kind of like a big balloon, and you're squeezing the opening and the air can't come out as fast or can't come out at all. So the weird thing is oftentimes when I have a kid that's coming in with a urinary symptom, my actual diagnosis has to do with a skin problem or a poop problem. Always, when your kid has pain when they pee, it's probably a good idea to come in and see the doctor and rule out the bad stuff. And if you have something that's just common, at least we'll be able to tell you how to take care of it.